Hey guys, we have a quick video about a couple of key points we wanted to go over for Skills Day.
So everyone in the system has to be trained on BFAST. Being in the ER, we're usually pretty familiar with it, but real quick, we'll go through it. Remember, BFAST stands for balance, eyes, face, arms, speech, and time. So any impairment with this generally means that the patient is a code stroke activation. So any alterations in this, we'll call a code stroke usually. And then just a reminder, because you guys are pretty heavily involved in code stroke activations, but just a lot of people don't know what our goals actually are, and we do a really good job at hitting them. So door to activation is less than 10 minutes, door to CT less than 15, door to needle or door to TNK is less than 30. And then door to device actually means those are the patients that go to IR for thrombectomy. So door to device is less than 90 minutes, and that's the only time we're kind of struggling with. We're trying to work on this year. And something you can do to help is when these patients are going to IR, treat them like they're going to cath lab. Get them completely naked in a gown. And then at nighttime, after hours, it's been really helpful for us to take that patient down when that team is responding in from home.
A couple quick trauma updates. The IO batteries, when you go into a room, push the little trigger. If the light on the back of it flashes red, like shown here, that means that it is dying and needs to be replaced. These aren't rechargeable. We actually order a new one every time they start to die. So one thing we're really asking everybody to be aware of is to make sure that we're taking repeated temperatures and that we're providing warmth for our patients, because cold patients don't clot. And so the most beneficial thing we can do to make sure our patients don't hemorrhage is to make sure that they're nice and warm. If their temps are low, we want to make sure that the room temperature's high, they're getting warm fluids. We do the warm blanket, bear hugger, and then during transport, we want to make sure that they're also having warmth applied. Even if the patient's temperature is normal, because we get them naked so fast, they do drop really quickly. So.
And then been getting some complaints from the floors. Just a lot of our IVs are showing up not appropriately dressed. So just a reminder that you want your top dressing on the top, and then you put the other one, the second biggest one, underneath that kind of acts as the pants. And then this little one with the writing on it, that is, we call it the belt. And so that goes over top and keeps your extension set kind of secured and then covers that opening where your hub is at the catheter. And it's best if you keep that hub kind of out of the way, so make sure you're positioning it right. And then for ultrasound IVs, we just want to make sure that when you are checking patency or making sure that it's good or you're struggling with it, that you're using a flush to verify placement. And you can kind of use the ultrasound probe to visualize the saline going through. We never want to re-put a needle back into that cannula because it can cause shearing, especially those really long cannulas. And a reminder, one of the biggest risks for ultrasound IVs is hitting a nerve bundle. So make sure you're looking for those on the ultrasound. They'll show up kind of as a white bundle, or sometimes they'll kind of have like a honeycomb appearance. And they generally run right along with veins and arteries.
Our system has gone to HealthStream to document ultrasound IVs. We have to document 10 a year to maintain our certification in them. We didn't do it last year, so we're going to be really good about doing it this year. So we're asking everybody that's ultrasound IV trained to get into HealthStream and do it. If HealthStream is not already in your tools, it would be good to put it there. So you go to your tools directory and go down to the H's, and then you can just click this little Add My Tools button and put it in there. It is a new program. It replaced Kahuna. It has a lot of overlap with Workday, and it is not going anywhere. They are putting more and more items in there. Your point of care tests were in there today. You guys won't have to worry about selecting this screen, so pretend this one didn't happen. And then you'll have an ultrasound IV task here. You have to do 9 self-assessed every year and have 1 assessed by somebody else every year. So it'll be sort of like one of these. You'll get into it, and there'll be like a place where you can fill out the self-assessed one and click Met. So if you have any questions with any of that, keep track of them. And then when you see um, one of the two of us, let us know and we will make sure we show you how to use it. Thanks, guys.
Thank you.